So if you're only missing one tooth, why a dental implant over a regular bridge? What's the advantage?
The advantage is, in the long run, the implant's less expensive.
Okay.
And because, most dentists know that a bridge is not going to last forever. And when it fails, what are you going to do? Typically, you'll lose another tooth on that bridge. If you put an implant in, you can stop that cycle. And over the long term, that's a lot less expensive.
So you told me there's like 30 million, 50 million people wearing an upper lower denture.
60 million people in the United States are edentulous.
Starts with one tooth.
Yes.
Do you think if you could catch these people early enough, clear up the gum disease, give them a single tooth, you could stop that snowball?
Oh, sure. And I've seen it. I've got one lovely patient in the practice who's over 90 years old, and she's had implants starting in the 70s. Okay, so you can look at that x-ray and see how old some of those implants are. But she has this wonderful life. She has this wonderful joie de vivre. She eats what she wants. She has confidence. And so she took the steps that she needed to do 35, 40 years ago to make sure she had the smile that she wants when she's 90.
So traditional bridges will also be out in dentistry?
I think so.
Someday.
I think so. When you think about, as a dentist, what you have to do to make a bridge, and how you have to shape those two other teeth, and how you have to destroy them to restore them, I think it's absolutely, no question that they'll be gone.
So if somebody in your family, and they were of the age to do this, was only missing one tooth, would you always go implant over a bridge?
Yes, absolutely. Now, I mean, circumstances are circumstances, but if they're missing one tooth, and it's an important tooth, and I've done this with numerous of my patients. We put an implant in and put the tooth on. Many times, with the techniques I'm using, I can put the implant in and put the tooth in the same day, the same visit.
Okay.
One visit. Changes your life.